A little bit about our department and some of the work that we've been doing over the past year or so. And so to bring us all kind of on the same page in terms of who Access Alliance is and what we do, as well as our community-based research and evaluation department, as an organization, we have our strategic directions and priorities, and we also work from something that we call the Power Package. And so that centers around these 4 words: access, attachment, engagement, and equity. And so when we're speaking about access, this is really about understanding, assessing, and also reducing or eliminating the barriers that our clients and community residents face when accessing care. And so moving to attachment, this whole morning is on attachment, but of course this is about facilitating meaningful attachments, which I think we really hit home in terms of the presentations that have come up today. Regarding engagement, this is about building and strengthening relationships with our community members and clients through active engagement. So we recently hosted a community validation and engagement session for one of our community health needs assessments, not only to share the information and findings, but to gather what they would like us to do with it. What should we do with the organization? How should we proceed with advocacy efforts? So that planning is really co-designed with our clients and community members. And finally, around health equity. Health equity is about supporting our clients and community members to achieve their health potential as they see it for themselves. So we're just a conduit or a facilitator for our clients to achieve their best health in a way that works for them. Then over on the right-hand side of your screen is a framework for our research and evaluation department. So we're not just knowledge generators through our Access Alliance-led or partnered research, but we also take a key play in capacity building, whether that's with our team, our partners, or students, immigrant insight scholars, peer researchers, folks who are engaged with our team and activities. And then we're able to collectively use that information through knowledge mobilization and translation to work towards policy implications and real system change. And so feeding into that, we really try to work at all levels of the system. So at the community level or micro, meso, macro levels, this is really about the individual. So not only our team and developing their capacities, but with our clients and community residents for building responsive community workforces that are reflective of the populations that we serve. In terms of our organizational or community level, this is really about building culturally responsive and trauma-informed approaches. So we have our research table, which highlights our HEAL or hubs for expressive arts for life. Got it. Okay. As one of our key activities, along with things like our seniors medication studies. So how can we really take a larger play with our partners and our organization in improving those organizational and collaborative efforts? As a final note here, our learning health system, through our youth service needs assessments or community health needs assessments, really allow us to understand what is happening in the real time in our communities. And so this feeds into equitable resource allocation, strengthened neighborhood planning, and also supporting sustainable and locally responsive development. Finally, at our policy level here, activities like the Black Children and Youth Mental Health Project that we'll be talking and focusing about more on later this afternoon, along with our Better for All project and attachment readiness. This really shows how our organization, but in particular the research department, has a role in playing in making those systems change by bringing knowledge, but also taking that to a point of action and change management. So to pat ourselves on the back just a little bit more, we have our impacts report. Our 2015 to 2025 impact report was released last year, capturing a decade of really wonderful projects. This is available on our website. And then today we have for you to read through and take a look at our most recent research impact report, covering our partnerships and research activities that have been going on in the department over the last year. But just to highlight a few, we have our research activities listed on the screen. And who knew research could be so fun in terms of the artistic engagement that we have in our activities. For our evaluation, we have several community evaluations, but also our program evaluations that feed into those continuous quality improvement loops that we have at the organization. To touch on our capacity building, I mentioned that we do host practical learning and training experiences. And so we have many immigrant insight scholars, peer researchers, student placements, and volunteers. And over the past year, we've engaged over 30 individuals, 33 in our various activities. We have also released an updated peer researcher training handbook, so feel free to check that out. That's a free resource online, but we also will come into your organization and train with your team, share knowledge and experiences so that your organization can also take these methodologies and approaches to support capacity building in that sense. As a thank you, many of you who are here in the room today are partners. Of course, we could not do this work, and a lot of the good things that come out of everything that we do in this sector is through collaboration and partnership. So we wanted to take a moment to recognize you here as well. And I would also like to share some photos from our activities, lots of smiling faces, so that's really great. And we've had quite a few international visits over the past year from the UK and Germany as well, with a few more upcoming. So if you'd like to read a little bit more, we have our digital copy available, so you can scan the QR code. We also have some hard copies over at the research table that you can take home with you today. But thank you for this morning, and we're going to be taking a short break.